How do we check if that tiny butterfly gland in your neck, the thyroid, is actually working the way it should? Today, we're doing a deep dive into how that's done, and maybe more importantly, the benefits of getting tested. It's especially for you listening here in the UK.
Exactly. Our main source today is the guidance from Blood Tests UK, which is all about helping people get those answers quickly. We're really focusing on how GPs and the NHS approach these issues.
Right, because getting checked early is about so much more than just dealing with symptoms you have now. It's about, preventing some really serious problems down the line.
Okay, let's unpack this. So the foundation for all of this is, of course, the blood test. When your GP runs a thyroid panel, they're looking at three key hormones: TSH, T4, and T3. And this is where it gets interesting, because TSH is basically the boss.
It is. TSH is the signal from your brain telling the thyroid what to do. To put it really simply, if your TSH level is high, it means the brain is shouting at a sluggish thyroid that isn't making enough hormone. That's hypothyroidism.
Underactive. Yes, underactive. And if the TSH is low, it means the thyroid is working overtime, making too much hormone. That's hyperthyroidism.
And is there a specific number that doctors are looking for, a target?
There is. The guidance from sources like Blood Test UK, which GPs use, puts the normal TSH range between about 0.4 and 4.0 MIUL.
And the NHS routinely runs these tests, right? Which is a huge benefit in itself.
A massive benefit. It makes them so accessible. And that leads us to the big why. Why should you even care about this? Well, catching a thyroid problem early can stop it from leading to much bigger issues later on.
Like what kind of issues?
Things like heart disease. An untreated thyroid problem can raise your cholesterol, it can affect your blood pressure. It's all connected.
And that's where the accessibility in the UK really comes into play. Having the NHS means people can get these essential tests without a huge cost, which encourages regular checks for people who might need them most.
Like women or anyone with a family history of thyroid issues.
So it's proactive.
It is. And Blood Test UK really supports this idea of follow-up. For a condition like hypothyroidism, you'll typically need a check every 6 to 12 months to make sure the medication is working properly.
Okay, so the blood test is the starting point. But it's not the only tool, is it?
Not at all. Doctors also use other things. For instance, an ultrasound scan. It's like taking a picture of the thyroid with sound waves. That helps a doctor look at the gland's shape and check for any lumps or nodules.
And then there's the simple clinical exam, right? Your GP just, checking your neck for swelling, asking about weight changes, how tired you feel.
Precisely. The best treatment happens when you combine those test results with the patient's own story. And if things get complicated, that's when a specialist, an endocrinologist, steps in to help fine-tune everything.
So what this all really means is that the UK system, using this kind of guidance, is set up to check early and check often.
Exactly. It's a mix of good lab work and good clinical care. And maybe a final thought on that. It's important to remember that you can still have symptoms even if your test results fall inside that normal range.
That's a really crucial point. Which brings me to a final provocative thought for you to mull over. Should you be keeping a symptom diary? Tracking small changes in your mood, your weight, your energy, even when you feel okay. Because sometimes that personal record is what helps your doctor connect the dots in a way that the tests alone just can't.